Delighted to be here at the invitation of Hazy Health International to make some remarks as we mark International Female Genital Mutilation Day. I would rather we had these conversations all year round, but it is a good thing that we have a day set aside to discuss this very important issue. In recent times, there has been an astronomical increase in cases of sexual and gender-based violence in Nigeria. The continued rise in GBV cases has made it imperative to scale up multidimensional approaches and strategies in combating all forms of GBV. There are four main types of GBV: physical, sexual, psychological, and economic. And female genital mutilation sits squarely as a key manifestation of all these forms of gender-based violence. FGM affects at least 20% of Nigerian women, with 86% of these women being circumcised before the age of 5. From my experience in addressing female genital mutilation or gender-based violence responses, there are usually 5 issues to be taken into consideration as follows. 1, the creation of an enabling legal and policy environment. 2, the provision of treatment, care, and support for survivors of female genital mutilation and gender-based violence. 3, attention to education and sensitization for FGM and GBV prevention. 4, investments in community engagement and awareness raising to encourage ownership and involvement in grassroots communities. And 5, the existence of a coordinating mechanism made up of statutory bodies as well as civil society organizations to ensure sustainability of all the above measures. I would now like to tell you about what we have been doing in Ekiti State. Ekiti State has the 3rd highest prevalence of FGM in Nigeria and the 2nd highest in the Southwest. In Ekiti State, we have 2 main bodies that address the issue of female genital mutilation and gender-based violence. First, we have the State Technical Committee on FGM, which is domiciled at the Ministry of Health and Human Services. We also have the Gender-Based Violence Management Committee, which is the implementing body for the VAP law, and it also includes female genital mutilation. Over the past 2 years, we have been able to achieve the following. First of all, the speedy passage of the revised Ekiti State Gender-Based Violence Law in October 2019. By harmonizing the previous Ekiti GBV law of 2011 with the 2015 VAP Act, Ekiti State now has a stronger GBV law. The FGM law of 2003 is still in place and is also reflected in the new VAP law of 2019. We also have the Compulsory Treatment and Care for Sexually Abused Minors Law of 2020, the first of its kind in Nigeria. This legislation was signed into law by His Excellency, Dr. Adeleye Fayemi, on the 5th of June, 2020. The implication of this is that it covers the issue of medical attention required by minors who are victims of FGM. Through the Office of the Attorney General, the Sex Offenders Register of 2013 in Ekiti State was reactivated in 2019. In addition, Ekiti State now has a name and shame policy which publishes the names and photographs of convicted sex offenders in the state. Through this, anyone caught carrying out FGM will find themselves listed as a sex offender. We also have a range of services in place to respond to survivors of FGM or gender-based violence in Ekiti State through the Ministry of Women Affairs and Social Development, the Gender and Vulnerable Persons Unit in the Office of the Wife of Governor, my office, and also frontline service NGOs such as New Generation Girls and Women Development Initiative, Federation of Women Lawyers, Gender Relevance Initiative Promotion, and so on. In Ekiti State, we have a sexual assault referral center, as well as a transit home, a shelter in place to provide treatment, care, and support for women and girls. The GBV law of 2019 also makes provision for a survivors fund, the first of its kind in Nigeria. Since December 2018, this fund has been used to assist at least 213 survivors with rebuilding their lives. Examples of assistance provided include renting accommodation, starting businesses, payment of school fees, and other needs as determined by survivors. Female genital mutilation is a harmful traditional practice that is also a violation of the bodies of women and girls. And we take this very seriously in Ekiti State. Considering the fact that, as I said earlier, we have one of the highest prevalence rates in Nigeria, we believe that we needed to do some things that were out of the ordinary. And this is why in September 2019, I initiated what is now known as the Drop the Blades campaign in collaboration with the National Orientation Agency and Ministry of Women Affairs and Social Development. This campaign saw at least 120 women from 6 local governments in the state drop their circumcision tools in exchange for capital to start a small business. This campaign attracted recognition for Ekiti State from UNICEF in March 2020 as a model of good practice in the fight against female genital mutilation. In February and March 2021, this year, we are therefore targeting another 150 women who will be beneficiaries of this Drop the Blades project. The Gender-Based Violence Management Committee has embarked on a series of advocacy engagements with various stakeholders throughout the state, ranging from the judiciary to traditional rulers to local government leaders to heads of tertiary institutions, media chiefs, departments and agencies of government, and so on. The outcome of these visits has been very promising, and it will go a long way in ensuring the much needed ownership of responses to FGM and GBV. We have also expanded our various committees to include critical stakeholders who had not been earlier included. In June 2020, the Ekiti State Sexual Assault Referral Center, known as the Moremi Clinic, was launched at the Ekiti State University Teaching Hospital. The Moremi Clinic is a one-stop, free, survivor-centered initiative that prioritizes the rights and needs of survivors of sexual violence, including FGM. The SAC has emergency response, medical, legal, counseling, police, and community outreach teams. This enables the SAC to provide prompt medical treatment, collection and analysis of forensic evidence, counseling and psychosocial support, as well as legal services. A permanent site for the SAC was commissioned by His Excellency the Governor on the 25th of November 2020 as part of our activities to mark the 16 days of activism against gender-based violence. In October 2020, we entered into a partnership with Center for Population and Reproductive Health in Ibadan for the purposes of mainstreaming FGM responses into the Sexual Assault Referral Center. And also through the help of this organization, we now have a toll-free line that survivors or those who are at risk of FGM can call from different parts of the state. So in conclusion, I'd like to quickly go through some lessons that have been learned and some strategies I would like to recommend for all of us going forward. As I mentioned earlier, the issue of legal and policy frameworks are imperative. The National Legal Framework for Child Protection in Nigeria, for example, is the Child Rights Act of 2003. But to date, only 24 out of 36 states have adopted the act. For gender-based violence, it is the 2015 VAP Act, and only 17 states and the Federal Capital Territory out of 36 states have domesticated the act so far. Even though all the 6 highest FGM prevalent states have specific legislation, implementation of the legislation is usually hampered by a lack of political will and appropriate resources. I'm therefore proposing, and hopefully this will be given priority, that there should be more political will behind the implementation of these laws and policies, and that we have adequate human, material, technical, and financial resources for implementation of the laws. Another recommendation I have is that we need to insist on coordination efforts at both the national and state level. If we don't already have one, we need a national female genital mutilation task force, and we need at state level as well. These task forces at state and at federal and state level should be a multi-sectoral effort that includes government agencies, the police, the National Human Rights Commission, judiciary, religious leaders, traditional rulers, as well as representatives of civil society. We also need to do more in the area of treatment, care, and protection of survivors of female genital mutilation and all forms of gender-based violence. We only have 29 sexual assault referral centers in Nigeria, and these 29 sexual assault referral centers are only in 17 out of 36 states. So some states have more than one SAC, while some states have none at all. And we also have very few shelters across the country. So we need to invest more in the treatment, care, and protection of survivors. We have invested a lot in community ownership, but we need to continue to do more. We desperately need communities to own GBV and FGM responses. We need to ensure that we continue to work with traditional rulers, religious leaders, community associations, and others. We have done a lot of community engagement work in Ekiti State. We've done a lot of training, sensitization, awareness raising, using radio, using IEC materials, using community educators and peer leaders, and it has been paying off. We need to continue the unfinished business of women's empowerment. Women need education and training, economic empowerment and livelihoods, access to healthcare, clean water and shelter. Women need freedom from all forms of violence, and they need to have a voice in decision-making. The more empowered a woman is, the more likely it is that her daughter to be empowered too, and the more likely it is that she will make decisions that do not disempower or continue to endanger her children. We therefore need to continue to pay attention to the needs of mothers and their children. We are proud of our rich cultural heritage as Nigerian people. However, our cultural heritage should not be incompatible. We want in a world in which girls will not be considered of less value than boys. We need to continue to insist that our girls should grow up free of abuse, free of violation, and not considered to be second-class citizens. We need a new culture that values girls from the moment they are born, not one that considers it expedient to chop up their genitals. A culture that enables them to acquire an education, learn a skill, express themselves, think freely, make informed choices, develop confidence, and be able to fulfill their God-given potential. If we focus on this, then hopefully we will see a world in which everyone's value is recognized, and one in which all our development goals can be attained. We cannot continue to encourage a culture, encourage a society where all these abuses continue unabated. I'd like to close by calling all of us to action. There's something we can all do using the positions we are in, using whatever space we have. Let us all be a part of bringing an end to female genital mutilation. You can help with campaigns, you can be an advocate, you can donate money, you can donate your time, you can raise awareness. What you should not do is be someone who stands in the way of people who are doing all this work. Thank you very much once again for inviting me to talk about this. I really appreciate it, and I look forward to working with you all. Warm regards once again from Ekiti State, the land of honor.